Hey there, and welcome to This Explainer. Today, we're diving into a massive and honestly incredibly important topic: the addiction treatment landscape in the state of Texas. The sheer size of Texas means the options for care are just as vast and varied as the state itself. But hey, don't worry, we're going to demystify all these options for you. We'll be breaking everything down clearly using fresh, up-to-date 2026 data sourced directly from the experts at rehabcost.org. So whether you're looking for yourself or trying to help a loved one, this explainer is built to give you some real clarity and direction. Picture this for a second. Imagine the challenge of finding exactly the right healthcare in a state this huge. It can be completely overwhelming, right? What's available in a sprawling, densely populated place like Houston looks absolutely nothing like the resources you'll find in a smaller city like Wichita Falls or out in the quiet of the Hill Country. So where do you even begin your search when just the geography alone is a huge hurdle? Well, let's talk numbers, because the scope of the problem and the solution is pretty massive. 112. That is exactly how many Texas facilities are currently listed in the Rehab Cost Directory. Now, that's a whole lot of data to sift through, sure, but having 112 options means the right fit is definitely out there. Today, we're going to spotlight 10 of these centers to show you exactly how to filter down this massive list, helping you find the perfect environment, the right clinical approach, and a financial fit that works for your specific situation. Okay, let's just dive straight into our roadmap for today. First, we'll look at Texas-sized treatment options. Second, contrasting environments from clinical hospitals to rural ranches. Third, specialized support tracks. Fourth, we'll untangle the cost and insurance puzzle. And finally, we'll walk through navigating rehab costs' free resources. Starting off with Section 1, Texas-sized treatment options, where we're mapping out the care landscape. So the care landscape across the Lone Star State is, as you'd expect, highly fragmented, both geographically and in terms of the types of care offered. The 10 centers we're focusing on today span literally from the Gulf Coast all the way up to North Texas. We're looking at facilities right in the hustle of Houston, the Dallas-Fort Worth Metroplex, Austin, and San Antonio, but also sprawling, distinctive ranch country programs out in places like Hicko and Canyon Lake. This wide geographic spread is actually a great thing because it gives you the power to choose. You can decide if staying close to a major medical hub or retreating out to a quiet rural setting is the best move for the recovery journey. Moving right along to Section 2, clinical hospitals to rural ranches, looking at contrasting environments of care. The physical setting you choose plays a massive role in what the day-to-day experience of recovery actually feels like. To really get a sense of the options, let's compare two totally different facilities. On one hand, you've got Cross Creek Hospital in Austin, operating with Ascension Seton. This is your classic urban, clinical environment offering high-level, hospital-grade behavioral health care, including medication management. Now, on the other hand, you have Touchstone Ranch Recovery Center in Hiko. This is a literal working ranch that offers a rural, holistic alternative. They even have a signature equine therapy program. Both approaches are highly effective, but they offer completely, totally different day-to-day atmospheres. But what if you kind of want the best of both worlds? Well, check out Windmill Wellness Ranch, perfectly situated between San Antonio and Austin on Canyon Lake. Visually, it offers this gorgeous, back-to-basics 75-acre hill country environment. We're talking hiking trails and a pool. But clinically, it is highly advanced. They're using modern, cutting-edge tools like QEEG brain mapping and genetic testing right alongside traditional trauma therapy. It's this truly fascinating blend of nature and neuroscience. All right, Section 3, specialized support and tracks. We're talking tailored programs for specific needs. Now, what's really interesting here is that finding the right rehab isn't just about picking a spot on a map. It's about finding expertly tailored care for whoever is going. And Texas offers a massive variety of specialized tracks. For instance, Red River Hospital in Wichita Falls has a dedicated military resiliency unit, which makes total sense given they are right near Shepherd Air Force Base. Starlight Recovery Center in the Hill Country, they offer dedicated tracks for LGBTQ+ clients, veterans, and even those looking for a faith-based Christian approach. Cedar Crest in Belton covers the whole lifespan, with specialized programs for adolescents and seniors. And then there's the Positive Recovery Center in Sugar Land, which builds its entire curriculum around a positive psychology model, literally teaching patients how to actively pursue well-being, rather than just treating the symptoms. Another absolutely crucial factor when looking at specialized care is the actual size of the facility, because that heavily dictates the whole vibe of the patient experience. Virtue Recovery in Houston, for example, keeps things intentionally small with just a 24-bed census. This is designed for super individualized, intimate attention. Compare that to Cedar Crest Behavioral Health, operating on a massive 30-plus acre campus that supports recreational therapy, a full gym, and diverse age groups all at once. So you really have to ask yourself, Does the situation call for a tight-knit, quiet setting or a large, highly active campus? That brings us to Section 4, the cost and insurance puzzle, and understanding payer options. Let's be real for a second. The opaqueness of healthcare costs is often the single biggest hurdle keeping families from getting help. To empower those of you who might need low-cost or state-funded options, you absolutely need to know about OSAR. That stands for Outreach, Screening, Assessment, and Referral Centers. They basically act as the state-funded front door for eligible Texas residents trying to access treatment through Health and Human Services. If financial assistance is a necessity, this is a vital state resource you've got to explore. So the crucial point here is that out-of-pocket costs can be drastically reduced if you know exactly where to look. While most plans cover substance use disorder treatment under federal parity law, network acceptance is all over the map in Texas. But accessible options definitely exist. For instance, Valley Hope of Grapevine takes Medicaid. Cross Creek accepts Medicare and TRICARE, and both Cedar Crest and Red River Hospital accept Medicaid and Medicare while also actively serving our military personnel. You should always verify your specific benefits for sure, but this just proves that highly accessible choices are out there. And to put all of this into perspective, the level of care and the setting you choose will heavily dictate your final price tag. Outpatient and intensive outpatient programs, commonly known as IOPs, cost just a mere fraction of what full residential inpatient care costs. Furthermore, a private luxury campus, think Dallas Detox Center in Weatherford, with its upscale amenities and equine therapy, is naturally going to run a higher bill than a standard hospital-based program. Understanding these variables is absolutely key to planning your finances effectively. Which leads us perfectly into Section 5, navigating rehab cost resources. Here are the tools to help you find the right fit. Listen, you do not have to figure this all out alone. Rehabcost.org provides the ultimate set of tools to turn this totally overwhelming landscape into a clear, actionable plan. It really comes down to 3 simple steps on their site. Step 1, you browse their complete directory of all 115 Texas facilities, filtering by your specific city, the level of care you need, and your insurance provider. Step 2, review the average rehab cost by state so you can set a realistic baseline expectation. And Step 3, generate a fully personalized estimate using their custom cost calculator. And honestly, beyond just the cost calculator, rehabcost.org arms you with these fantastic free tools. They have an insurance coverage checker to verify your network status instantly. You can use their location tool to zero in on treatment programs specifically near your zip code. And you can read through their complete treatment guide for a much deeper understanding of how the whole recovery process works. It's like having a navigator right in your pocket. Actually, I want to pause here for a really important moment. If you or a loved one are in crisis and you need help right this second, please know that immediate life-saving help is always just a phone call away. You can call the SAMHSA National Helpline at 1-800-662-4357, or you can just dial 988 for the Suicide and Crisis Lifeline. Both of these are completely free, entirely confidential, and they are available 24 hours a day, 7 days a week. Please do not wait to get help. We've covered a lot of ground today, from bustling urban hospitals all the way out to peaceful hill country ranches, and we've looked at how to untangle the messy complexities of insurance. With so many wildly diverse paths to recovery available right here in Texas, my question to you is this: which tool are you going to use first to uncover the right care for your journey? Head on over to rehabcost.org to take that crucial next step. Thank you so much for joining me and diving into this explainer today. I really hope it's brought you some clarity, confidence, and most importantly, hope. See you next time.